Do you want to know the 3 things I tell my parents of newborns who are about to get a vaccine? Well, keep watching and I will tell you. This is Dr. Obidi. I'm a pediatrician at Partners in Pediatrics and Family Health and the CEO of Newborn Prep Academy, where we teach new parents what to expect from their newborns and how to care for them confidently. Well, when our new babies or our newborns are about to get vaccines, which typically here in the United States, it's going to be right around 2 months. They typically will get one at birth, a hepatitis B vaccine, but then the first series of vaccines will be anywhere from 1 to 2 months. In the practice here, we usually would do those at 2 months. And here are 3 things I tell my parents to watch for, because I think it's just helpful and helps to relieve some of that anxiety when they might occur. So one is your baby might have a fever as a reaction to the vaccines, and your body just sort of getting used to the antigens that have been introduced to help them fight off infection. And so they may have a temperature, a fever, and that typically will last 1 to 3 days. Oftentimes it's something low grade, 100 point something or 101, maybe even 102. But I typically tell them if you're having really high fevers, 103, 104 or above, typically 104 or above, or the fever is lasting more than 3 days, I typically will tell my parents to bring their newborn back in so that we can make sure there's nothing else responsible for the fever. But a fever in the first couple of days after a vaccine is not unusual. And if your baby is less than 6 months of age, some age-appropriate, some Tylenol, infant's Tylenol, or acetaminophen will typically take care of any discomfort or pain or fever. And if they're 6 months or above, they can get both acetaminophen or Tylenol, as well as ibuprofen, which might be brand names like Motrin or Advil. So again, of course, you want to check with your pediatrician for the appropriate dose for your baby, because it is dependent on their weight. And so you can hopefully get that information from them at those visits where your newborn is being vaccinated. The second thing I tell parents that might happen is the area in which those vaccines are given, which in babies typically will be the thighs. Those areas may get swollen and tender. And that may, some significant swelling or tenderness over it. So it's uncomfortable for the baby, might, feel reddish. Again, that should only last a few days or should get better as the days progress. You could use a cool compress over it. You can give them some acetaminophen or ibuprofen, depending on their age. Like I talked about earlier, if they are less than 6 months, they can only get acetaminophen. If they are 6 months or above, they can get both acetaminophen and ibuprofen. And that will take care of any discomfort, may also take care of any inflammation. If you're giving some ibuprofen when they're 6 months or older, help take care of some of that inflammation as well when if they do react that way to the vaccines. And the third thing I tell my parents to look out for will be that when the area starts to heal, you might feel a knot around the area where the vaccine was given. And that's typically from some slight bleeding into the muscle as your needle goes in to give those vaccines. They are typically intramuscular vaccines, so the vaccines are given into the muscle, as an example in the thigh area. And so there may be some slight bleeding, and that heals, the body heals that by first of all depositing some calcium into the blood, so it gets really hard, and then the body starts to reabsorb it over time. So I tell them not to be alarmed if a few days after the vaccine they feel a hard knot developing in the area. That typically would take several weeks to eventually resolve, and is usually not cause for concern. Now, of course, with any of these things I just mentioned, if you just feel really uncomfortable about the way your baby's looking, so they have a fever. I know I say, that you can have a fever in the first 1 to 3 days, and that's normal. But if your baby's just looking really sick, they're vomiting, they just don't look well, they're not eating, absolutely reach out to your pediatrician to make sure there's nothing else that you need to be doing. Or if, the area is swollen, but it's really looking like that you're just uncomfortable about the way it looks, or maybe you're even finding something like a pus discharge from the area, you certainly want to reach out, or to reach out to your pediatrician again to evaluate that further. Or if they have a knot in the area and that's just going on weeks on end, doesn't seem like it's getting any better, or maybe it's getting even more tender or more painful, you certainly again want to bring that to the attention of your pediatrician. But these are three things that happen, ever so often as babies get vaccines. And so as a parent, if you know this going in, you can, at least be a little more relaxed those first few days to see if they're okay. Especially if there are no other red flags for you, okay? So again, this is Dr. Obidi of the Newborn Prep Academy and pediatrician at Partners in Pediatrics and Family Health. Wherever you're watching this, there'll be resources that you can click into to get more information to help you care for your newborn and care for them confidently. All right, bye for now.